Okay, let's jump into this. Have you ever spotted like a weird little bump or maybe a growth on your dog or cat?
Mm,
Maybe like a pink sort of wart-like thing near their mouth or maybe a flatter spot somewhere on their belly?
yeah, it happens a lot, actually. And owners are often left thinking, you know, what is that?
Exactly. So today we're doing a deep dive into precisely that, veterinary papillomatosis.
Right. These are basically growths caused by different papillomaviruses. They affect the skin and also the mucous membranes in pets.
And for this deep dive, we're working from a pretty detailed veterinary reference source. It's the kind of thing clinicians use, right, to understand and manage these.
That's the one. Really detailed.
So our goal here is to kind of unpack all that info from the source. We want to figure out what these things really are, why they show up, what they look like in dogs versus cats, and, how vets actually deal with them.
Yep. The aim is to get you well informed on this specific topic pretty quickly.
Okay, so fundamentally, it's viruses causing this.
It is. Various papillomaviruses. But, a really key point right from the start, from the source material, is that it's not just one single kind of bump.
All right.
There are different forms listed for both dogs and cats. So it's a bit more complex than just a wart.
And here's something that caught my eye, and it sounds a bit concerning.
Hmm.
The source mentions that while lots of these are harmless, some specific types, I think they call them viral plaques.
Yes, plaques. Often flatter, yeah.
Those ones apparently have the potential to become something, well, much more serious down the line.
That's absolutely correct. The source is clear that some of these particularly certain plaques can potentially progress. They might turn into something called boanoid in situ carcinoma BISC, which is
Mm-hmm.
like a precancerous skin thing,
All right.
or even into squamous cell carcinoma, SCC, which is a type of skin cancer.
Wow. Okay.
So yeah, while they're often benign, that potential for transformation, it's a really crucial point the source emphasizes for certain forms.
Okay, that definitely changes things a bit. So who's most likely to get these growths? Does, like, age or breed play a big part? Or maybe other health stuff?
Oh, absolutely. And the source breaks it down quite nicely, actually. It's pretty specific depending on the species, dog or cat, and even the type of papilloma.
Right.
So for dogs, there are some clear age patterns. You tend to see the oral ones, those kind of classic wart-like things in the mouth,
Yeah, I've seen those.
or the types that affect the foot pads or the genital areas, more often in puppies and younger adult dogs.
Okay, why them?
Well, it's typically when their immune systems are maybe still developing or it's their first time encountering that particular virus.
Makes sense. What about older dogs then?
Older dogs, they're generally more prone to the kind of raised, outward growing skin ones. The source calls them exophytic cutaneouses, papillomas, and also the inverted type. Those grow sort of inwards and often have like a little central pore or opening.
Okay. And you mentioned those pigmented viral plaques before,
Yeah.
the flat, darkish ones.
Yes. Those have a really strong breed link in dogs, according to the source.
Oh, really? Which breeds are we talking about?
The source specifically points out miniature schnauzers and pugs.
Schnauzers and pugs, huh?
Yeah, and it also lists Boston Terriers and French Bulldogs. And interestingly, if you see these specific plaques in other breeds, it's often linked to the dog being immunosuppressed for some other reason.
That's fascinating. So age and breed are big factors for dogs, often linked to different types of these growths. What about cats? Is it a similar story?
Actually, cats are quite different. The source materials suggest that papillomatosis in general is more common in older cats.
Older cats, okay.
Yeah, especially cats that have some underlying condition that's weakening their immune system. A common example given is FIV, feline immunodeficiency virus.
Ah, okay. So less about being young and naive to the virus like in puppies, and more about being older with a maybe compromised immune system.
Exactly. That seems to be the pattern, particularly for those feline viral plaques, the ones that have that potential to turn cancerous later on.
Right, the ones we mentioned earlier.
Now, the source does mention another thing called feline sarcoids, which are also a type of feline papillomatosis, but it notes those are actually more common in younger cats that go outdoors. So a different pattern for that specific type.
Okay, that's a really important difference. Older, maybe immunocompromised cats for one type, but younger outdoor cats for another. It really sounds like the immune system is, well, central to this whole thing, doesn't it?
Absolutely, both in terms of who gets them in the first place and maybe whether they stick around or go away. And the
Yeah.
source definitely reinforces that. It suggests that, for instance, those oral papillomas in young dogs who haven't met the virus before, getting them can actually trigger a really strong immune
Oh,
response.
interesting.
Yeah, leading to lifelong immunity once the lesions finally clear up. And for the skin types in dogs, there's some thought that maybe specific defects in their cell-mediated immunity might be involved.
Hmm.
And then, like we said, that strong link between an older cat with a weakened immune system and developing those plaques and maybe having them progress. That's a major takeaway from the source.
Okay, so let's try and picture these things. What do they actually look like? Because I imagine they can vary quite a bit. And where do they usually pop up?
Yeah, the source gives some good descriptions. The common skin ones on dogs, the cutaneous ones, are often described as pedunculated.
Pedunculated, like on a stalk.
Exactly, growing on a little stalk. And they have fronds of epithelium, which makes them look a bit like a tiny cauliflower head or maybe, like a sea anemone.
Okay, I can picture that. The classic doggy wart look.
That's pretty much it. They're usually small, maybe up to a centimeter or so across, and they can really appear anywhere on the skin.
Right. But you mentioned specific types in specific locations, too.
Yes. So canine papillomavirus, the one we often think of, most commonly hits the inside of the mouth, the oral mucosa, the hard palate, sometimes even the epiglottis way back in the throat.
And that can cause problems, right? If there are lots of them.
It can, yeah. If a dog has a mouthful, it might interfere with them picking up food or swallowing properly. And if they accidentally bite them, that can lead to, bad breath or extra drooling.
Yuck. Yeah.
They can also sometimes be confined just to the genital region or maybe the eyelids.
And what about those inverted ones you mentioned? The ones with the pore?
Right, the cutaneous inverted papillomas.
Huh.
They're less common. You often see them as multiple bumps, especially on the dog's underside, the ventral abdomen.
Okay.
And like we said, they tend to grow inward, presenting as this raised bump, but with a little opening or pore right in the middle. And the source makes a really important distinction here. These are caused by a totally different virus than the common oral type, COPV.
Huh. Fascinating. Different viruses, different looks. What about the ones on the foot pads? I've heard those can be really sore.
They definitely can be. Multiple papillomas of the foot pad, usually seen in younger dogs.
Yeah.
They show up as these firm, thickened, really hard lesions. The term is hyperkeratotic right on the pads.
Ouch.
Yeah, and that can cause real discomfort, even lameness, because it obviously hurts to walk on them.
And those pigmented plaques you mentioned earlier, the ones linked to specific breeds, where do you usually find those?
Those canine pigmented viral plaques, yeah, the ones in Schnauzers, Pugs, Bostons, Frenchies, they typically show up on the less hairy skin, like the belly, the ventral abdomen, and the inner thighs.
Okay.
And the source does note something interesting here. These specific pigmented plaques rarely turn into that serious skin cancer SCC.
Oh, that's good news, at least for those specific ones.
It is a bit of a silver lining compared to the potential worry with the cat plaques.
Right. Speaking of cats, what do their forms generally look like? And where do they tend to be?
Well, for cats, the source says that the stalked, wart-like ones on the skin, the cutaneous papillomas, are actually pretty rare.
Oh, okay.
What's much more common in cats are the feline viral plaques. And these can look quite different, from small bumps maybe to larger patches that might be darkened or even crusty sometimes.
And these are the ones with the potential to progress.
Yes, these are the ones we discussed earlier that have that potential to turn into those precancerous lesions, BISC, or even invasive carcinoma.
Got it. And what about the feline sarcoids you mentioned?
Feline sarcoid lesions, the source says, are uncommon. They're
Yeah.
typically seen in older cats, like over 10 years old. And they are frequently linked with those other underlying systemic diseases that cause immunosuppression, like FIV.
Right, the immune connection again.
Mm.
Okay, so a vet sees a growth like this. How do they figure out, for sure what it is and whether it's one of the concerning types?
Well, the source indicates that often, just by looking at it, the gross lesion, it has a pretty typical appearance that strongly suggests papillomatosis.
So visual clues are important.
They are. But just looking isn't always enough because other things can look really, really similar.
Ah, okay, that's where the differential diagnosis list comes in, all the other possibilities.
Yeah. Exactly that. The source lists quite a few conditions that could be mistaken for papillomas. And this really highlights why getting a definitive diagnosis is often necessary.
Like what? What else could it be?
Well, take inside a dog's mouth, for instance. What looks like an oral papilloma could potentially be a common benign gum growth, that's a fibromatous epulis, or it could be something more serious like a transmissible venereal tumor, or even squamous cell carcinoma itself.
Wow, okay. So could be harmless, could be cancer. That's a big difference. What about on the skin?
Similar story. On the skin, a simple cutaneous papilloma might resemble other benign things like an overgrowth of oil glands, that's sebaceous hyperplasia, or just a simple skin tag, an acrocorton.
Okay.
Those pigmented plaques we talked about, they might be confused with a benign pigmented tumor called a melanocytoma. An inverted papilloma could look like another type of skin cyst, an infundibular keratinizing acanthoma.
So many lookalikes.
Yeah, and for cats, the list of things that can mimic papillomas includes inflammatory lesions, like from eosinophilic granuloma complex, or sun-damaged spots, actinic keratosis. It could even be lesions related to feline leukemia virus, or, again, actual squamous cell carcinoma.
That list is, well, it's long. It really drives home why just glancing at it isn't always going to cut it. So how do they get that definite answer?
The gold standard, according to the source, is to get a biopsy.
Take a little piece of it.
Exactly. Take a small sample of the growth and send it off for histopathology. That's where a veterinary pathologist examines the tissue under a microscope.
And they're looking for specific clues.
They are. They're looking for the specific cellular changes that tell them it's a papillomavirus infection.
Okay, what kind of changes are those, microscopically?
The source describes some classic signs. You'd typically see thickening of the skin layers. Technical terms are hyperkeratosis and acanthosis. And really importantly, characteristic changes within the skin cells. There are these cells called koilocytes, which have like a clear halo around their nucleus. And you might see abnormal large granules within the cells too. These are like the virus's fingerprints at the cellular level.
Koilocytes, okay. So those specific cell changes are the big confirmation under the
The
microscope.
key identifier, yes. Although the source does point out that those pigmented viral plaques, especially in dogs, might not actually show those specific koilocytes or viral inclusion bodies.
Oh, okay.
So even microscopically, there can be some variation between the different types.
Interesting. What about things like blood tests? Do they help with the diagnosis?
Generally, no. Standard blood work, like a CBC or a biochemistry panel, is usually completely normal if it's just papillomatosis.
Okay.
But for cats, remember we talked about the link with immunosuppression?
Yes, FIV and potentially FAO.
Right. So for cats, testing for those underlying viruses, FEL-E and FIV, is definitely relevant and important because of that strong connection.
Makes sense. Okay, so we know what they are, who gets them, what they look like, how they're diagnosed. What can actually be done about them? How are they treated?
Well, here's some potentially good news that the source emphasizes quite strongly. Most lesions, especially those common oral ones in young dogs, will actually regress spontaneously.
Meaning they just go away on their own.
Exactly. They just disappear without any specific treatment. So often, a wait-and-see approach is perfectly reasonable, particularly for those young dogs with the mouth warts.
Okay, that's reassuring. But what if they don't go away? Or if they're causing problems, like the foot pad ones? Or if it's one of those types with the cancer risk?
Right. In those cases, intervention is definitely needed. Surgical removal is a common option.
Just cut them off.
Pretty much. That could mean simple excision, just cutting it out.
Mm-hmm.
Or it could involve freezing it off, which is cryosurgery, or using electric heat to remove it, electrosurgery.
Okay, surgery. Are there medications too, like pills or creams?
Yes, the source lists a couple of medical options as well. One is alpha interferon.
Interferon. Okay.
Yeah, the source even gives a specific dose for cats, 30 units per cat given by mouth once a day. Another option mentioned is a topical cream called imikimod.
Imikimod. How does that one work?
You apply it directly onto the individual lesions. The typical regimen mentioned is about 3 times a week for roughly 4 weeks.
Okay.
However, the source lists some really important cautions and potential issues with imikimod that you need to know about.
Oh, like what?
Well, first, there's potential for the person applying the cream to get exposed, so careful handling is needed.
Good point.
Second, it commonly causes quite a severe localized reaction right where you apply it.
A reaction, like redness and swelling.
Exactly. Redness, swelling, soreness. It's actually an expected part of how it works, stimulating the immune system locally, but owners definitely need to be prepared for it. And the source also advises caution when using it right at the edge where skin meets mucous membrane, like around the lips or genital areas.
Okay, that's really useful practical information if someone's considering that treatment.
Absolutely. And just circling back to cats for a second, remember the link to underlying diseases.
Yeah, the immunosuppression.
Right. So a really important part of the management strategy for cats involves diagnosing and, if possible, addressing any of those concurrent health problems, because that significantly influences their long-term outcome with the papillomas.
That makes total sense. Okay, so after diagnosis, maybe treatment.
Hmm.
What kind of follow-up is generally needed? And is there any way to prevent these things in the first place?
Good questions. For follow-up, the source states that patient monitoring is necessary, especially for those types that are known to have that potential for malignant transformation.
So keeping an eye out for signs they might be turning into SCC.
Precisely. Watching for any changes that suggest progression to squamous cell carcinoma.
And prevention. Can you stop pets from getting them?
Well, for the contagious oral form in dogs, the main method mentioned in the source is pretty straightforward. Just separate dogs that have active oral papillomas from susceptible animals.
Like puppies or dogs that haven't had them before.
Exactly. Especially important in places like kennels or shelters. The source also notes that some commercial kennels might consider using something called an autogenous vaccination.
Autogenous vaccination, what is that?
It's basically a vaccine that's custom-made from the affected dog's own papilloma lesions.
Oh, wow. Made from their own warts.
Essentially, yes. The idea is to try and stimulate a stronger, more specific immune response using the exact virus strain that's causing the problem in that individual dog.
That sounds potentially quite effective.
Yeah.
But you said the source mentioned controversies or issues.
It did, and this is a really key point to understand. The source clearly reports that these autogenous vaccines have, unfortunately in some instances, been reported to actually induce tumors themselves.
Wait, induce tumors? Like cause them?
Yes, specifically epithelial tumors or even squamous cell carcinoma right at the site where the vaccine was injected.
Oh my goodness, that's serious.
It is. And what's more, this reaction can be significantly delayed. The source mentions a latency period, the time between vaccination and tumor appearance, of anywhere from 11 to 34 months.
Wow, that's a huge potential risk and such a long time frame.
Mm-hmm.
So deciding to use that kind of vaccine is definitely not straightforward.
Not at all. The source flags it as a significant potential complication to be aware of.
Okay, so finally, let's put it all together. What's the general outlook? What's the prognosis for pets that get diagnosed with papillomatosis?
For dogs, overall, the prognosis is generally considered very good.
That's okay.
The source mentions the incubation period time from exposure to seeing lesions is about 1 to 8 weeks, and typically the lesions resolve on their own, usually within 1 to 5 months.
That's a few months, typically.
Usually. However, it also notes that in some cases, particularly maybe the cutaneous forms or inverted ones, they can persist for much, much longer, sometimes 24 months or even more.
2 years, wow. So usually good, but sometimes requires a lot of patience.
Definitely patience might be needed sometimes.
What about for cats?
For cats, especially thinking about those viral plaques and the precancerous BISC forms, the long-term prognosis is really heavily influenced by whether they have those other concurrent diseases.
The ones causing immunosuppression, like FIV or FLV.
Exactly. Successfully managing those underlying conditions is absolutely crucial for their overall outcome regarding the papilloma lesions.
That makes complete sense, given everything we've discussed about how tied together their susceptibility and the progression seems to be with their immune status.
It really is intricately linked.
So, okay, wrapping up this deep dive then. We've seen that veterinary papillomatosis is, well, it's a common viral thing, but it has a lot of different faces in dogs and cats.
Definitely not just one thing.
Right. While it's often benign, sometimes just goes away by itself, certain types carry this real risk of progressing to cancer. That seems particularly true for immunocompromised older cats, or maybe in specific dog breeds with those pigmented plaques, though those rarely transform.
And diagnosis relies on, visual clues initially, but then that crucial microscopic confirmation through biopsy.
Yeah. And management can range from just watching and waiting, letting the immune system hopefully sort it out, all the way to surgery or medications like interferon or that nimicamide cream with all its cautions.
And prevention focuses mainly on avoiding exposure for the contagious types or potentially considering those autogenous vaccines, but being very aware of the risks involved.
This dive really hammered home the spectrum, didn't it? From a simple temporary wart to something that could be a sign of a deeper issue or even a precancerous lesion itself.
It really did. Covers a lot of ground.
You know what really stands out to me looking at all this information from the source is just how absolutely central the animal's own immune system is to this whole story.
Hmm.
It seems to dictate, like, who gets susceptible in the first place, what the lesions end up looking like, whether they just vanish on their own or if they take that darker path and maybe transform into something serious. It's really a fascinating, pretty complex dance going on between the virus and the host's immunity, playing
Oh.
out right there on our pets.